Hello everyone, my name is Emmanuel Sentongo. This is my father, Mr. Chigundu Stephen. We are from Uganda. We came to Yashoda, I'm the attendant, and I came to attend to my father who was the patient and was going through was supposed to go through a procedure of CRTP replacement. To begin with, my father got a disease before 2011, had a heart problem. He had issues with breathing. He could not breathe very well. Then he would cough a lot and have pain in the chest. So we started seeing a local cardiologist that side by the names of Dr. Peter Lwabi, who checked and assessed that he needed to have a pacemaker to help him in the breathing, to help his heartbeat. So in 2011, we were sent to a hospital in Bangalore, still India, where we came. They did the first procedure. However, in 2016, they had to replace another one, which they did. But in 2019, he still got the same problem. He could not breathe very well. He had problems with walking. He could not walk very well. Then he would even feel pain. He would feel pain. At night, he could not sleep. His family members were very worried, and his employers, which is Bank of Uganda, they had to give him a bed rest and tell him to first stay away from work. So when they did that, he stayed home for some time while the local cardiologist was observing him, Dr. Peter. Then after a while, Dr. Peter realized that his issue could be treated in Yashoda Hospital, and this is Hyderabad in India. So he wrote to his employers, which is Bank of Uganda, requesting them to transport the patient to Yashoda Hospital's Hyderabad for a CRTP treatment and analysis. So the employer, Bank of Uganda, through its insurance, paid. Then the patient was able to come with a tenant. On our arrival to Yashoda, to Hyderabad, through the airport, we were received first in by the hospital itself. They transported us from the airport to the hospital, gave us some time to rest, very hospitable. This was done through the international office that connected us. They took care of us. Once we were admitted, they did everything. They tested again, they checked everything, just to make sure that the patient is okay, just to make sure that the patient was ready, just to make sure what best procedure to take for the patient. After doing everything, they found out, I think they did it through Dr. Rajeshka. They checked everything, and they found that he had leads from the previous procedures on the left side. And they advised that they could not leave these leads out. These leads had caused an infection to him. That's why he was having challenges in breathing. That caused an infection to him, and it would complicate everything. So they advised that they had to do 2 procedures. They had to remove the leads first, the old leads from the previous procedures of 2011, 2016, and 19. Then they had to put a new pacemaker. So we were scared. We kept on praying, but they assured us and they explained everything very well. That is something to thank them of. They explained everything to me. They made me understand. They make the patient understand whatever you're going to go through in a simpler way. Then they did the first procedure of removing the leads successfully, which was very hard, and most hospitals find it very hard, but they successfully did it. They removed the leads from the left side. That was the first operation. Then once it was successful, only one lead that was complicated, and that required an open chest operation, which Dr. Rajeshka said might be risky, can lead to cardiac arrest. So he advised we can leave it there, but it has no harm. So after removing the 2, which had reduced on the risk of him having infections again, they had to put a pacemaker. The team headed by Dr. Rajeshka, Dr. Babu, Dr. Ganji took part in the first, then even in the second operation, where they inserted the pacemaker, the new pacemaker on the right side, successfully assessed everything and gave us assurance that 99% it would be successful. They checked everything, They took care of him very well. In their ICU, very excellent equipment that check everything that they want, give the results in time, and the doctors kept on coming and checking on us. The medical team, the sisters, the nurses, they are all caring. So after the second procedure, which was very successful as well, they admitted him into the ICU, took care of him, healed very well, gave him the necessary medication because they have an inbuilt pharmacy within the hospital itself, so you don't have to go out and buy medicine. They have the medicine inside. Everything is well stocked inside. After that, after we have healed, they made sure that me and the patient were taken to a guest house, their guest house near the hospital, and they kept on checking on us still and caring for us. The patient currently feels very well. He breathes very well. He sleeps very well. He doesn't have that pain while coughing, and the coughing has gone down really. We thank the Yashoda team. We thank Dr. Ajeshka. We thank Dr. Babu, Dr. Ganji, and the nurses. We thank the international team, Harry, we are Bashir, Aju, Raul. We thank you guys. We thank you for taking care of us. It's still COVID time, but still they take concern that even after they have done that, they are making sure that at least we take the COVID test, because it's also here. You can take the COVID test while you fly back. To all our international patients, to all the international people who are having the same problem, and people from Uganda, we can assure you that Yashoda Hospital has the best, and it has everything. It has the experienced doctors who know what to do. They will explain to you what they are going to do. They will take concern. Once your patient is here and the attendant, they'll make sure that they take care of the patient, that even the attendant finds it very much more easier. They have best rooms inside. Once they admit you, their rooms are self-contained. Food, their food is okay. They take care of you. We would like to thank Yashoda Hospital. We would like to thank the team, the doctors, and the people of the international office. Thank you very much. We are grateful. We would like to thank our employer, Bank of Uganda, back in Uganda. Thank you for the opportunity. Thank you. Asante sana.
Thank you, the doctor and the staff. Thank you so much.
Mr. Stephen is a gentleman who was referred to us with a very unique problem. This person had what we call severe heart failure, for which he was implanted a cardiac resynchronization pacemaker several years ago in a different hospital in the country. Subsequently, when the device got infected, the device had to be removed and the patient's heart failure deteriorated. So generally, when there is a device-related infection, we need to explant the device and treat the infection. But this patient was so much in advanced heart failure that his heart failure symptoms significantly deteriorated once the device was explanted. And there was an attempt to reimplant at a different hospital, and that was not successful. This patient came to us seeking our help. When we assessed this patient, we were faced with a peculiar problem. This patient already had 3 leads which were left inside the heart when the device was explanted. And these leads were in place for several years. And therefore, and these were not usable because these leads were cut when the device was explanted. So these 3 leads were no longer usable for this patient. So if we had to implant a new device, we had to put in 3 more new leads. So that would mean that there would be a total number of 6 leads inside his heart, which is not a very good situation. So there was only one option left to us, was to extract the 3 leads, and then in the space that was provided by this, to put in 3 fresh leads and a fresh pacemaker implantation. So lead extraction is a very complicated procedure, and it is not usually routinely performed by all cardiologists, because the leads that have been inside the heart and inside the veins for many years get encapsulated in fibrous tissue, and therefore a lot of dissection is required to free the leads and extract them from the body. So it is a very time consuming and effort intensive procedure, which requires a lot of gadgets, a lot of equipment, and a lot of skill and patience to extract. So we took up the challenge because this patient definitely needed to have a pacemaker, and there was no way we could have put in 3 more leads without removing the pre-existing leads. And by using the specialized lead extractor systems by Spectranetics, we could successfully remove 2 of the leads, and the 3rd lead was left inside, and we could put in 3 fresh leads, thereby giving the patient a new lease of life. So this was a complex, time-consuming, and effort-intensive procedure, and we are happy to be able to execute the procedure without any complications, and thereby giving the patient a new lease of life. The patient is now implanted with a new cardiac resynchronization pacemaker system and has responded extremely well to the treatment and is doing very well.